Welcome back to Your Health in Your Hands. And we're talking about cardiovascular disease, which is the number one cause of premature death worldwide. And we talked about we kind of like went over some of the issues around cardiovascular disease and why we need to focus on cardiovascular disease as a country, as a nation. And the top thing that I feel that we need to pay attention to is high blood pressure. And we were talking about how high blood pressure can actually affect your endothelium, the lining of your blood vessels. So we're going to go into that some more. But before we go into that, I want to touch on certain myths and certain fallacies. High blood pressure is not something to be sneezed at. It is a very, very serious condition. The fact that you don't feel anything, the fact that you feel okay, doesn't mean that your blood pressure is low. And some people come to me and they say, well, whenever I have a headache, I know that my blood pressure is high. And so that's when I'm going to take my medication. That's wrong. You need to take your medication exactly how your doctor prescribes it. And sometimes they may prescribe 2, sometimes 3 or 4. It's extremely important that at all costs you maintain your blood pressure at the normal limit. And there's going to be a chart in front of you on the screen showing you exactly what the normal levels are at different ages at different stages. So if you're 30, the range, the acceptable range. If you're 40, the acceptable range is there. I think that's very important for you to understand that. Do not joke around with it. Also, if your doctor says you have a hypertension and it has been established over a period of time, sometimes you have to do it like 3 times in a week. Don't say I'm going to pray about it and it will go away. Don't take that chance. Don't say I'm going to ignore it. Maybe it's because I'm tensed. I'll not worry about it, and then when I feel that it's time to check it again, I'll go and check it. Pay attention to it, and once you have been diagnosed as hypertensive, make sure you take your medications and make sure you keep on checking to ensure that those medications are working and keeping your blood pressure under control. So please pay attention to that. Why is high blood pressure a bad thing? I think we need to understand that. High blood pressure, which simply means that the pressure at which the blood is going through the blood vessels is higher than what it should be. If you think about a water hose, I remember when we were kids, we used to have to water the garden and water the grass and all that, and we have to squeeze and make sure the water sprays everywhere. If you think about a water hose, the water hose has been made to withstand a certain amount of pressure. So if the water coming out of the tap is too strong, if the pressure is too strong, you will notice that after a period of time, especially if the water hose is of very inferior quality, after a period of time you will start seeing cracks in the walls of that hose, and after a period of time you start seeing the water spraying out of the hose rather than out of the very end, the nozzle where it's supposed to be. So you want to, if we take that analogy and put it in when it comes to the arteries, the walls of the blood vessels, the walls of the blood vessels were designed to take and withstand only a certain amount of pressure. Once that pressure, and there are different reasons for which that happens, some of them known and some of them unknown, that's why they use the word essential hypertension. Over a period of time, if that pressure, that sustained pressure is continually affecting the blood vessels, you will see that the blood vessels begins to get injured. You get to have tiny scars, tiny tears in the blood vessels. Unlike the water hose, the blood vessels don't just stay torn like that. Instantly, the body decides to repair that damage, and it does that by forming scar tissue. It puts fibrous tissue in place. The immune system jumps on. There's all kinds of inflammation and things going on, which again brings us back to that word, jaga jaga. All in the attempt to heal and restore the lining back to normal lining. Many times that doesn't go as well, especially if your lifestyle isn't the best, you're not eating well, you're not sleeping well, you're heavily stressed. That process is not well established. So after a period of time, remember what we said, you can eventually start getting cholesterol deposits, even platelet deposits, and this will now start causing blockages in the flow of the blood vessels. So you see the blood starts going up and down, trying to avoid this. Again, it can get up to about 70% of blockage and nothing will happen. But that last straw can actually break the camel's back. So you can actually have a tear. Once the blood pressure is sustained at such a high level for too long, you can actually have a tear and the blood will spill out. If this happens in the brain, it's called a hemorrhagic stroke. If it happens in the heart, it's called a heart attack. Usually, more often than not, what happens is that there's a blockage. So you have the 100%, maybe 90%, 100% blockage, and the cells over here simply die. So hypertension can cause that. Hypertension can also cause damage to the kidneys, and as a matter of fact, the number one cause of kidney damage and kidney death, and by extension, dialysis, when people have to go to the dialysis like 2-3 times a week, is hypertension. Number two commonest cause of kidney death and high dialysis is, of course, diabetes. So hypertension, again, is nothing to be sneezed at. You need to ensure that your blood pressure is maintained. Now, obviously, some people have problems with blood pressure medications. Sometimes they have to use like 4 or 5. We may treat that in a different session. And part of that is because the truth is many of these drugs were made with white people in mind. And they just simply assume that because everybody is a human being, what works for the white person will, by definition, work for the black person. That's not true anymore. As a matter of fact, we're looking at white men, and they're doing research between white men and white women, and they're finding out that the white women respond differently to the drugs that are made by white men and for white men. So one of the problems with antihypertensive medication is that they don't work for everyone, and so you have to keep on padding medication. And I mentioned in my last session too that many times people may be taking all the different medication, the right medication as the doctor prescribed, 4 or 5 different ones. They're eating right, they're jogging right, they're exercising, they're trying to keep everything under control, their stress levels, and they still have high blood pressure. That's a problem. And I think, again, we need to address that. Some of it is because of our genes. Some of it is the way our bodies process these drugs. And I think we're going to, like I said, in other sessions, we'll probably look at that some more and explain why. But in my opinion, in many cases, such people who are having these challenges will have to supplement. We mentioned vitamin D3. We're going to talk about vitamin C and some other things that can help with improving the health of the cardiovascular system. The point that we want to take away from this is that you want to watch your blood pressure always. Don't take it for granted. Don't lose sight of it. And I hope we've been able to explain and really emphasize why you have to keep your blood pressure levels in the normal range, and you want to try and avoid letting these spikes happen. So be sure to talk to your doctors about this. Be sure to educate yourself. Be sure to go online. Your doctor can't tell you everything in 10 minutes. So you need to find out for yourself, especially if high blood pressure runs through your family. The next session, we're going to be talking about how your teeth, you see a poster behind me, how your teeth affect your endothelial lining and therefore cardiovascular disease. We'll be right back.